Welcome back to another episode of Child Please Podcast. I am co-founder and visionary Erica Simpson,
I am Regina Weathersby.
and we have a special guest today, my friend Toria Pettway. She is a licensed social worker. She's a psychiatric social worker who specializes in trauma. So before we jump into it, I'm gonna let Toria tell us a little bit about herself.
Okay, sure. Thank y'all for having me, first of all. Thank you, Child Please. All right, so a little bit about me. My name is Toria Pettway. I am from Huntsville, Alabama. I attended Alabama A&M University, the greatest HBCU in the land known to man. Now, if anyone thinks differently, no offense, please don't take any. Um, I did my undergrad and my grad degree there. Um, I have an array of experience ranging from child welfare to medical social work. For the past couple of years, I have been focusing more so on trauma services, psychiatric social work. So I'm working with individuals that have been impacted by traumatic experiences, ranging anywhere from gunshot wounds to being caught up in a house fire, receiving bad burns, or losing a loved one in an accident, things of that nature. And so we try to focus on addressing that acute trauma that can come along with that and getting ahead of it as opposed to being behind it.
Good deal and welcome.
All right.
So today's topic is going to be just a little different. It's called the pregnancy before the pregnancy. And as you all know, we try to make sure every podcast theme relates back to maternal health. But this one may just be a little different because we're just going to talk about trauma as it relates to us as a people, specifically to us as Black women. So when you think about a lady that's pregnant, she enters pregnancy carrying whatever that has occurred to her from childhood up until then, whether it's childhood trauma, sexual trauma, infertility trauma, pregnancy loss, racial trauma, all of that is compounded. But once she becomes pregnant, she doesn't develop a new slate. And if she's not able, she and or her partner are not able to deal with and manage that trauma, it will trickle over into the next generation. So I'm gonna start with one question. We provided Toria some questions, and she did some pretty in-depth research. So we're gonna let her tell us what she found. So the first question, Toria, what are some forms of trauma Black women are carrying long before they enter the living room or even before they see the OBGYN for the first time?
Okay, so that's a really good question. So I'll just start this by saying I am not a leading expert in trauma, but I can tell you what I have seen and what I have experienced. Okay. All right. So y'all just think about it from your own perspective. You all were young Black girls at one time, right? You all had childhood. You all had things that may have or may not have occurred to you. But those things that did occur to you, they stuck with you. You understand what I'm saying? So there's no difference in these Black women who are coming to the doctor's office, going to the OBGYN for their regular annual physicals or even for their maternity needs, right? Um, it can, impact trust. It can impact communication. It can impact pain reporting because we all know that some individuals, despite the level of education that they have received, believe that our Black skin is thicker than other skin. That's just one example. So, you got all of those different things, and then the discomfort of the examination itself, not only physically, but also mentally of what it can do. So you're talking about medical racism and discrimination. We're talking historical and intergenerational type traumas. When you talk about the non-consensual experiments that we had to go through from the father of gynecology himself, all the way to someone thinking that they're going in and getting a simple exam, but then they're not being walked through what's being done to them, kind of just having it rammed on them, so to speak. Tell me what's going on. Tell me what I'm going to feel. You know what I'm saying? Let me know what you're grabbing. What's that device that utensil you're grabbing over there? Communication itself helps a lot. Think about pregnancy and birth trauma. A lot of miscarriages that individuals, may have. They may have had multiple miscarriages, or they may have had a stillbirth and things of that nature. And so they may be um happy to be able to be in the OBGYN office because they're currently pregnant, but in their mind, you can't say that they're not thinking about what could possibly become of this pregnancy currently. You know what I'm saying? You got racial stress, you got, like we said, healthcare mistrust. It's so many different things, y'all. I could go on and on. I mean, tell me when to stop. Body related stigma. We got a little bit of everything that's going on. But one that bothers me the most out of all of these is the socioeconomic stressors that come when we go into a doctor's office, especially an OBGYN clinic. You have financial strain, you have unstable housing, you have caregiving responsibilities, you might have transportation issues. You can't get off work to be able to go to the doctor because you don't have the time, or your job doesn't have that amenity or what have you for you to be able to do that. Um, and that can add a lot of significant stress, before, during, and after a medical appointment. And the main thing that individuals, medical professionals, sometimes are quick to say is that an individual is non-compliant. But that's because they're only seeing that person from one side or one spectrum. What I love about our profession as social workers is that we look at individuals as a whole, right? So we're going to take the home into consideration. We're going to take the finances into consideration. We're going to take your background, how you came up, and things of that nature into consideration. We're taking all of that into consideration. So if they were to go to that person's home and they walk in and they flip the light and they realize the light switch don't come on, they open the refrigerator and there's no food in there, but you got 3 other kids running around the house and she's pregnant, don't say that she's non-compliant because she missed the appointment. She's probably trying to figure out how she's going to feed her existing children that she has. So this is all the type of trauma that we're talking about.
And even before we even get to pregnancy, I was talking with a friend not too long ago about another friend that we have. I think the fear of things that have happened, not even necessarily to us, but to someone related to us, that we fear going to the doctor. And by the time we eventually go,
It's too late.
it's too late. It's a situation that they could have mitigated and you could have gotten treatment. Um, and
Easily.
like and like you say, I think fear, but I think the fear is based out of historical trauma.
A lot of it is. A lot of it is. And then, you have to be able to have that connection with that individual. I mean, I'll be transparent. Initially, I had a a, a OBGYN that was not of my race. And I'm not knocking the services that they provided to me, but there was a little disconnect there. But when I switched over and I found someone that was of my race that I could speak to, that I felt like I could connect to, I felt like I could relate to, I feel like my experience has been so much better. And I feel like when certain things are recommended of me, you know what I'm saying? Well, Toria, hey, we think you may need to do this procedure, or we think we may need to do this. I'm able to receive it more because I don't feel like I'm being experimented on, or I'm being kept up in a trend. Well, everybody else is getting this done. Might as well go ahead and get it too. You've hit that age. Well, my stuff still, okay. I don't feel like I need that right now. So I appreciate being able to have that open relationship with my OBGYN. You're on mute, E.
Thank you.
Yeah.
Before we go to the next question, Regina, any thoughts?
I actually was thinking about, I guess, trauma and what I was thinking as you all were talking was just looking at some of the things that Black women carry even before they go to the doctor. And some of those things have nothing to do with the actual doctor, with the medical experience. As a therapist, I think about some of the people that I've had the opportunity to work with. And a lot of times when it's a Black woman, somewhere in the story of her life, she's carrying a lot for everybody around her. She's
Yes.
caring for everybody around her. There's a lot of weight on her shoulders, um, a lot of responsibility and pressure that she might have to make sure that life goes as it should for everybody around her. Um, Even if she has support, especially if she's someone that is one has one of those personalities where you're the strong friend, and so everybody comes to you, and so you carry things from your friendships, you carry things from your family, you carry things from your household, you carry things from work, and all of those type things. So there's just this compounded pressure on you that has nothing to do with the medical experience, but you're carrying that with you into a new experience if you become pregnant. And so just thinking about, and not to mention any trauma that you may have experienced before in your life. So there's that part of it. And then it's where you are now with that sense of sometimes feeling overwhelmed um, with the pressure and the responsibility of where life can be in the society that we live in. And so just carrying all of that into a medical experience. I think before you even walk in the door can create a feeling of anxiety,
Yeah.
of frustration, of fear, all of those
Difficulty
things.
taking those recommendations that are being made of
Mhm,
the physician,
mhm.
that could be an issue too.
And sometimes just simply tired. Sometimes people just tired going into it. You already tired because you know all the things that you have. So that's where my mind was as you all were discussing just the other things that separate from the medical experience that people carry with them into um an appointment if they're pregnant or when they're going to see their OBGYN.
And
Yeah,
that leads,
I'm
go
sorry.
ahead.
I was gonna
Go
say
ahead.
thank you. I'm sorry for interrupting y'all and saying Regina, but like you got me excited when you mentioned that because I was thinking some individuals were touched inappropriately, right? They were molested. And then so now we're not only talking about a physical thing because this is the OBGYN's responsibility. Like this is a part of their job description. They're going to have to touch you, in areas where you were inappropriately touched.
Mhm.
um but on top of that, it's causing for you to focus on when Uncle so and so did something to you, and you may have tried to tell someone in the family and they told you, well, we don't talk about, we don't talk about that, or that ain't happened, or they dismiss you, so you feel dismissed and you also feel violated and everything like that. So that was a good point. I just wanted to say that was a really good point to bring out. But it points out to me how important it is when the professional is doing their procedures to communicate what the individual is going to experience and feel as they're doing what they're doing. Hey, you're going to feel something cold, you're going to feel this, you're going to feel that. Walk them through it. Don't just take them down through there. Go through it with them.
Yeah. I think I mentioned strong friend. I think that's a good bridge into the second question that we have about Black women frequently being praised for being strong while receiving very little support for recovery. And so I guess the question is, have we confused survival with healing?
Yes, we have. There's a meaningful difference between that because survival, you're talking about being able to go through difficult circumstances, right? Being able to endure that, and function despite the adversities and things like that may come around. But healing is when you have had an opportunity to process those experiences and you have the ability to recover from the effects of what occurred to you. Um, when you were going through the traumas that you were going through. And I just feel like, people have done a lot of research on this and stuff like that. This has been a common topic, amongst girlfriends as well as in professional settings, both formal and informal. And it's nice to be acknowledged as a strong person and to have resilience and strength and be able to bounce back. Thank you. That's nice. But that puts a lot of pressure on an individual to have to suppress feelings of vulnerability. It causes them to delay in seeking help because they're too busy trying to attend and uphold everybody else and their needs, prioritizing everybody else over themselves and things of that nature. So I guess the question is, you know, have we confused survival with healing? That's the question that I have, because in a sense, that's what it seems like it has become.
I feel like when I hear survival, I hear you didn't die.
But you
You know
didn't
what I mean?
die.
But you didn't die, right?
Yeah.
That has nothing. Sorry, that has nothing to do though with your quality of life.
Yes.
So you're living, you survived, but what is your quality of life
Yes.
right now? And so we don't want to just not die. That's not good enough. You know what I mean?
Right.
Like you can go through some stuff and it doesn't kill you, but God, out, like
Right.
but can we get to a place where we receive the help that we need, whether at this point professional or personal with friends or however you need to do it? But hey, I'm an advocate, I'm a therapist, I'm an advocate for therapy. But can we get to a place where we can have a good solid quality of life, whatever that is for you, where you're able to enjoy, where you're able to have peace, where you're able to have rest? You know what I mean? Just
Yeah.
to be able to enjoy moments in your life so that you're able to look back and say, I have a pretty good life, not just I woke up today again and I ain't die. But you
You're
feel like
here.
but you feel like at any moment you could. To me, that's you just surviving something. But we
Yeah.
don't want to just survive. We want to live.
You know,
But on the flip side too, I think, as we're talking about providers, but from a personal standpoint, you can't hear what you're not willing to speak. So I think it's twofold. Yes, we expect a lot from healthcare providers. And like I said, we don't just take it out of the hospital. We expect a lot from relationships, from friendships, from platonic or romantic relationships. But and a lot of times we walk around angry and mad at our friends or our partners because they didn't do this or they didn't respond the way, but they can't respond to something you haven't voiced. I mean, we're not mind readers. And so I think, going back to the question or the statement, the strong Black woman, we have to be and get comfortable being in a place of being vulnerable and being able to say, this is a problem. I need help. Because a lot of times, just period. Even, in a marriage, you ask your husband, hey, what's wrong with you? Nothing. But clearly you can see the whole demeanor has
mhm.
changed. The whole atmosphere has shifted. But like I said, none of us, I mean, social workers have some magical powers, but we're not mind readers.
No,
And
no.
just people in general, people are not mind readers. So what does it take for us as a people to move from wanting to just be in survival mode to being healed?
It takes action. It takes acknowledgement.
Yeah.
You know, sometimes that saying, you so you so far in the forest, you don't see the trees. That's a true statement.
It
You know,
is.
so having to me, like when you're talking about healing and stuff like that, because I feel like we have mistaken resilience for recovery, and that's not the same thing. Just having that permission to be able to rest without guilt, you know, being able to get support instead of always having to provide it. So a lot of times it depends on the spaces that we as individuals choose to put ourselves in. Because if we acknowledge that we're in environments that are not conducive to where we are trying to go, why do we continue to stay there and think the outcome is going to be different? So that's why I say it takes action on our part. Like you said, it's a twofold thing. You never want to, blame the victim, but there is some accountability that must be taken on the victim's behalf. And that's not about blaming them or anything like that. Mm-hmm.
I also think that you got to know that an action needs to be taken in order for you to take the action.
Mm-hmm.
So what I'm saying there is, historically, vulnerability in our community gets you killed.
It looks weak. Mm-hmm.
Right. And then in addition to that, vulnerability wasn't modeled for you. You didn't see people when you were growing up, you don't see people being vulnerable. And so that was survival has been normalized for us. It's been normalized. And so you don't see it. So you do what you have seen modeled for you. And if you hadn't seen people be vulnerable, then you tend not to go in that direction. But when you get information, then you're responsible for the information that you have, and then you can take an action.
Yes.
The issue is that if you don't ever know, then you don't ever do.
And that's where I feel like we as social workers and mental health clinicians and stuff like that can take a bigger step. I appreciate just the event that you all had recently where we were able to sit down and literally have discussions. That alone opened the door for so many people, to be able to have a different look on things and say, oh, you know what, that was going on back then. That ain't normal. You know what I'm saying? Like, but again, it has to be brought to the forefront. So I think that if we were able to have these discussions in our communities with our people, I just think about like menopause, for example, because I'm getting of that age. I'm approaching it. Everybody want to talk about the hot flash. Nobody said anything about a perimenopause to me. Nobody said anything about me forgetting why I walked in a room and what I'm looking for, the brain fog and everything like that. There are so many other things that go along with menopause than just a hot flash. You know what I'm saying? So, or the change, as they say. So my thing is, when we learn better, we do better. So the main thing that I feel like what we can focus on is making sure that we get that information out to individuals. And that's really what I appreciate in my role, that I'm able to do. Because a lot of times individuals will come in with an injury or whatever, and their sole focus being in a hospital is making sure that they're physically healed, and they're not acknowledging that there are some emotional and mental things that are going on with your injury as well that you need to address. We need to discuss. So let me point this out to you. You had a positive PTSD screening, which means that you may experience some symptoms of PTSD. You may have flashbacks. You may have some insomnia or be awakened out of your sleep and not able to sleep because you're thinking about what occurred to you. And that's normal. That's normal. But you don't have to suffer through it alone. We have things that we can do. We can talk you through it. We can get you talk therapy. We can get you some medication if you need it. We can do both. We can do what you want to do. You know what I'm saying? But letting them know that they have those options. So that was a good point, Regina, making sure that's just put out there.
And I think from working in healthcare as a social worker for a while, that's a key point. I think a lot of times and I've said this before, you can have somebody, both can have the same illness. Both can have pretty bad illnesses, but this one survives, they overcome, they live, and this one dies. And I think a lot of that has to do with the mindset.
It does. I believe that.
And let me just say this. Let me go back because I had a thought. I said something. I don't want it to be misunderstood. I said surviving to me when I hear that. It's just how my brain works. When I hear that, it means like you didn't die. But I don't want to diminish the fact that it takes work to survive. Like it's not just, I'm not, so I don't want to make it sound like you just didn't die. Like a lot of people literally fight for their life to survive. So I do want to acknowledge that. But at the point that the event that caused the trauma is over, my thought was just don't stay at that place of, okay, I survived, being able to continue in your journey so that you are able to have a quality of life that you would want and not just staying at that place of survival. That just came to my mind. I didn't want anybody to be offended by it because I know we use the word survivor in a lot of different things connected to medical terms or diagnosis. And so again, I don't want to diminish any of that. Like, but for the purposes of trauma or whatever, like once we've survived it, as we get information, just being able to still move forward in our lives and have a quality of life where we're not constantly living in the space impacted by the trauma that we experience.
Yes. And you know, oftentimes we as Black women, we are celebrated for our resilience and we don't get a lot of support for our recovery or what have you. And the strength that you talk about or that survival, that's what helps us to get through those hard times and those various hardships or what have you. But we have to know that survival is not the same as healing. It is not. Just because you got through it don't mean you got through it. You feel where I'm going?
Yeah.
And so the question is, for me, it's not whether or not Black women are strong enough, it's whether have we been given a space? Have we been given the support? Have we been given the safety to heal? That's the question for me.
Well, now that you have thrown that in the mix, I believe our time is up. So you just earned yourself a part two, Toria, of trauma. We coming back. You gonna be so Toria will likely be our guest for next month because we had a couple other questions on here that we really wanted to answer. And now some of them I think we kind of answered them in talking, but we're gonna extend the invitation. Tori, are you gonna come back with us for part two?
I would be honored to, guys.
Well, we appreciate you coming because, like I said, I think this is trauma is a very it's a long road. I mean, once you kind of get on that road, it's a long drive, and so and I think we just really scratched the surface today. So I definitely don't want to leave us and our viewers kind of like on a cliffhanger. So
Okay.
for now, we're gonna table part one of the pregnancy before the pregnancy. So I guess maybe our next episode will be the birth after the pregnancy.
Okay. Sounds good to me.
All right. So again, we appreciate you, Toria, for joining us today. And we thank you all for tuning in for another episode of Child Please. And make sure you tune in for next month's episode, part two.
All right,
Until
y'all.
next time.
Bye.
Bye.